Do you feel like with iodine, one of the I guess you could say one of the biggest groups that are out there, talking about don't do iodine, right? They're saying this is contraindicated if you have Hashimoto's or if you have Graves. It's a question and a conversation topic that comes up quite a lot. What is your opinion on giving iodine to people with autoimmune, whether it's hyper or hypothyroidism?
Well, I think that's easy. We can tackle this in 20 seconds. So, have iodine levels gone up or down over the last 50 years according to the government's own statistics? I'm asking you.
Oh, you got it down.
50%, greater than 50%. Have Hashimoto's, Graves' disease, the two most common autoimmune thyroid disorders, gone up or down over the last 50 years?
Oh,
So, autoimmune thyroid disease has gone up, iodine levels have gone down. I should do it this way. Iodine levels have gone down. That's called a negative association. Now, that negative association disproves iodine as the cause of this rise in autoimmune thyroid disease. Period, exclamation point. It's the end of, we don't really need to talk about it beyond that. It's done. And could iodine correct this autoimmune thyroid disease? Well, we should have studies for that. Um, Perhaps, but iodine has not caused this. It's iodine deficiency that's caused it. And yes, I can tell you from 30 years of using of treating people with hormone and nutrients that iodine cures Hashimoto's and Graves' disease in a vast number of patients. To have a hypothesis has to withstand all criticisms to be true. So if the hypothesis is that iodine causes Hashimoto's disease, that that taking iodine it causes Hashimoto's disease, or supplementing with iodine increases your risk of Hashimoto's disease. That's the hypothesis. Well, I've got an N of two that I raised that showed that's the opposite case, and I've written about this extensively in my thyroid and iodine books. But my two daughters, Haley and Jessie, are 12 months apart. And my wife was smart enough to make the diagnosis because they were like the shoemaker's kids without shoes growing up. I was busy, in this practice. And look, I was a good dad. I was into all their games and, I was very involved. And, but I get home from work and the kids were complaining, being tired and, they got headaches and they were playing sports. And, I didn't want to hear more complaints when I got home, so I might have shut my brain off a little bit with them, with some of the medical complaints. But anyways, we're having dinner one night, and I think the kids were about either 9 and 10 or 10 and 11. And my wife says to me, "Do you think they have a thyroid problem?" And my wife has hypothyroidism. I have hypothyroidism. And I remember I had like a fork or a spoon or something near my mouth. She says it. I put the spoon down. I grab my forehead. I'm like, "Oy, you know, I haven't checked them. I check everybody else. I think every patient gets a hormonal nutritional evaluation except for my kids." Um, so I credit my wife with making the diagnosis because I had the kids come in, get some blood work. They have raging Hashimoto's disease, both of them. And so I checked their iodine levels as part of that. The iodine levels were low, which is the case with Hashimoto's disease. Um, and I start supplementing them with iodine. And then over a couple of years, I see their Hashimoto's titers, which were in the thousands to start, come down. And now they're 30 and 29 years old, but by the time they were in college, they had no signs of Hashimoto's disease. Um, so, and when I lecture about this to doctors, I show the progression with their lab tests, as they come down, and I kept upping their iodine dose as they went down. So that's an N of two that disproves the hypothesis that iodine causes Hashimoto. Iodine, supplementing with iodine causes Hashimoto's disease. It's actually iodine that treats it. And I don't know how many, it's got to be thousands of patients now. Between me and my partners, it's multiple thousands of patients. We've tested over 8,000 patients, new patients in our office for their iodine levels, and 97% have tested low. And they're not testing quite as low now because a lot of them come into our office and have read my book and they're taking iodine on their own. But if they're not taking iodine, just kind of living the American life and eating the American way, they're generally all low. Most of them are low in iodine, over 97%.
Now, you testing iodine? Are you using like a urinary loading test for that, or how are you measuring?
So the accepted measure of iodine levels is urinary excretion testing. So you can use a spot iodine testing if no one's taking iodine, where they just pee in a cup and you go measure the iodine. If they're taking iodine, the only way to measure it is with a iodine loading test. I described that in my iodine book that my mentor developed, and I had a little hand in that with him, Dr. Guy Abraham, and it's a functional test of iodine status in the human body.
So is that where you're giving them 50 milligrams of iodine and having them do a 24-hour collection?
Yes.
Yeah. Um, what do you think about people that with active autoimmune thyroid disease that start iodine? There's a number of reports that they don't feel as well or they start feeling worse. Do you have a description or an explanation chemically for why that might be for some people?
Well, so I don't think it's wise to I think it's wise for people. I don't think it's wise for someone to listen to this and go, they're taking 50 milligrams of iodine, and see how they feel. The worst doctor is your own doctor. Be your own doctor. That's the worst doctor. You need someone independent of you who is iodine literate. And they're out there. There's enough of them out there who are iodine literate and can properly test you and take it. So is iodine needed by everybody? Well, look, it's an essential item we can't live without. Every cell in the body needs and requires iodine. So should every single person take iodine forever from the moment they land on this planet? No. I mean, look, I see people get side effects from taking vitamin C. I see people get side effects from taking magnesium. You drink enough water, you can kill yourself. So, it needs to be done appropriately. You need to measure levels. And, most people, the vast majority can take iodine and feel good with it. Iodine is one of the few. Do you use iodine? Do
Oh,
you
all the time. Yeah.
see it with your clients that,
Yep.
I mean, iodine is one of the few things you can put somebody on where they really feel better, like right away. You can put them on all the other stuff, a lot of the B vitamins and whatever, herbal things and like that. A lot of it they don't know. They take it because we tell them to take it, and maybe their labs are better, maybe they're not, but they don't really feel any better with it. Iodine's one of the few things you can give a real bang for the buck, and the buck is important because iodine's fairly cheap. As supplements go too. I'm in the weeds right now, and I forgot what you just asked me. Oh,
I
people
was just
feel good with iodine. So, yeah, there are people who don't feel good with iodine, and the vast majority of those are detoxing. It's called a Herxheimer effect. They're overloaded because iodine's coming into an iodine deficient system. The receptors are all brominated and fluoridated, and then the iodine comes in, moves that bromide plus or minus fluoride out of there, and the body has to get rid of these toxic halides and can get overloaded and it can make people sick and like particularly flu-like symptoms, headaches, fatigue, things like that. And in that case, usually what I tell people is stop taking iodine, take salt. Salt's really important to take with iodine, unrefined, healthy salt like Celtic salt or Redmond salt. And, take a teaspoon or two of salt a day for 2 weeks, go back to the iodine, and the salt helps you get rid of these other toxic halides, bromide and fluoride, and minimizes that. It's very, very few people can't take iodine after doing that. I have a book on Salt Your Way to Health, that is, it's just a mainstay of what I do in my practice. And that gets rid of doing it this way gets rid of those few people who have problems taking iodine.
Yeah, okay. So can't be allergic to iodine. If you have side effects or symptoms, it's probably a detoxification Herxheimer type response from release of bromine or bromide and fluoride.
I don't know if you can't be allergic to iodine. Look, you can probably have an allergy to. I think there are people that have an allergy to. There's definitely people that have an allergy to organified iodine in the form of iodine dyes given, for radiologic testing. A blue moon patient, these are really infrequent patients, probably may have an allergy to some iodine supplement. Maybe it's something in the supplement that's, with the iodine. They are out there, but they're just few and far between. I mean, these are patient every few years, something like this happens.
Okay. want to go talk a little bit about Graves, if you would. It's probably one of the most under discussed. Most people are so because Hashimoto's is more common. And so one of the biggest comments we get back is, what about Graves? Um, you mentioned, I asked you a minute ago with autoimmune thyroid disease, you said Graves or Hashimoto's iodine would be kind of place to start. But what other kinds of things are you seeing that are helpful for people with Graves? Diet, is there a diet change? Are there
I
nutrient?
I love treating people with Graves because they get better. And I have a whole chapter on that in my thyroid book. And Graves' disease is a hyperthyroid condition, an overactive thyroid condition where the thyroid's being overstimulated from particular immunoglobulins. It's an autoimmune disease. So the body's producing these chemicals that are stimulating the thyroid to make a lot of thyroid hormone, and it makes people nuts. They don't like it. You can get fast heart rate, the nervous, jittery palpitations kind of goes along with that. But people can tolerate hypothyroidism or an underactive thyroid much easier than can tolerate hyperthyroidism. So Graves has been written about for, I don't know, I don't remember exactly when it was first diagnosed, but it's got to be 100 plus years ago. Um, what the treatment for Graves' disease was 100 years ago?
No.
Iodine. Um, there's much in the literature from the late 19th century to the early 20th century, case history after case after case history of treating Graves' disease with iodine. And in our office, we have 7 practitioners. We all pretty much treat it the same way. We use iodine all the time for Graves' disease. And the conventional treatment for Graves' disease is using radioactive iodine, where you burn the radioactivity kills the thyroid gland as it's taken up. It's radioactive iodine, so as the radioactive material binds to the thyroid gland, it destroys the tissue. And treating somebody like that reminds me of, well, I got an infected fingernail here. What do you think, doc? Well, let's just cut off the finger and we've solved the infection of the fingernail. So what we treat Graves' disease with is clean up their diet, get sugar out, and get gluten out of the diet because gluten cross reacts with thyroid antibodies to stimulate the thyroid gland. Um, um, higher dose iodine helps to calm the 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 oxidative damage that's going on in the thyroid gland, and then things like B vitamins and vitamin C also helps to squelch that oxidative stress that's going on in the thyroid. And we just don't find Graves that hard to treat in our office.
Yeah, I've had very similar experience where the gluten-free diet, for many, will take their antibodies level down to non-measurable, and then couple that with good nutritional support, good nutrients. Um, so you're measuring then, going back to what you measure. So a full spectrum, a full array of different thyroid markers beyond TSH. You're measuring the different nutrients, including iodine. You're changing people's diets. Aside from gluten, as it relates to thyroid antibodies, do you find any other things? You said gluten, you said sugar, but are there any other foods that you find to be big triggers for people with autoimmune thyroid or just hypothyroidism in general?
Well, look, I think they need to eat a healthy diet, and drinking water is part of that healthy diet. Getting sugar out. Sugar is just the worst. There's one thing that everybody should do is cut out refined sugar in their diet. I think it's the single most important thing to do. And then getting seed oils out. I mean, look, it's not, the more you can do, the better it is. But simply cutting out gluten, cutting out sugar can make a huge difference in pretty much anyone's condition for almost anything, but particularly for thyroid problems and autoimmune thyroid problems.
Okay. Is there anything that you would like to add that you see that's super common around thyroid that's less discussed, maybe not quite as well known that you feel like people watching would benefit tremendously from?
Well, I mean, the one thing is, and you touched on it, was this push by some naturopathic doctors out there that it's iodine is toxic and you should go on low iodine diets, and there's just no research to support that. It's just one of the things if you lower iodine levels enough in people, yeah, the thyroid gland, if it's hyper, will slow down because there's just not enough iodine in there to make any hormone. But let me tell you, they're going to get problems with the breasts and their ovaries and the pancreas and the uterus and prostate and other glands in the body. That's like I got a fingernail infection. Let's cut off the finger and we solve that issue. That's silly to do it that way. Um, the literature doesn't support that hypothesis. We remember hypothesis has to withstand all criticisms. If that's a hypothesis that it's iodine excess causing all these problems, well, we already solved that because iodine levels have fallen over the last 50 years, while thyroid problems have, including autoimmune thyroid problems, have increased dramatically over that time period. That's negative association just proves that. So are there other things? It's just, do the basics. Basics are I would say the basics are just a couple of things. Drink water. The human body's about 70% water. The brain's 80% water. Drink half your body weight in water. Um, Two, get salt in. Second major constituent in the body is salt next to water. Um, about a teaspoon. If you have heart failure or kidney failure, you got to, again, work with a iodine literate, salt literate, water literate doctor, a holistic literate doctor, and don't be your own doctor with this. Three is balance the hormonal system using bioidentical natural hormones. Four is correct iodine deficiency. And the fifth thing I'd say is the basics is exercise. There's a disease out there that exercise doesn't help. People need to get off the chair. They need to get away from the computer. The kids need to get away from, the games that they're playing right now and, exercise. And I don't mean, going to a gym. If you go to a gym, great. If you don't want to go to a gym, put some tennis shoes on and go for a walk. I tell my patients you have to do at least 30 minutes a day every day. I don't really care how you feel. The only people that shouldn't be exercising are the ones that they exercise and they're in bed for 2 days later. There's something else wrong that you got to correct first before they can exercise. But exercise helps everything. And, I'd say do the basics and, starting with eat a good diet and let's get crap out of our diet. And hopefully RFK Jr. and the Maha movement, and we'll be able to correct that and get our health back. Country's a mess, man. We're not. I feel I'm going to see the downfall of our country if we don't correct this. We spend 20% of our GNP on healthcare, and what the hell do we get for it? We don't get better longevity rates compared to our equal Western countries out there. We're the worst. We get more mortality. We get more infant mortality, more maternal mortality at birth. We get more chronic disease. We're fatter than everybody else. All the other Western countries on the planet, it's a mess. We have more chronic illness, and we're dying earlier. And that needs to be addressed. And I think time is now. Let's do it.
Yeah, amen to that. I think I hope that this movement creates an awareness and a self-responsibility that people need to take apart and not outsource their health to other people's opinions and to pharmaceutical medications as a reliance for, as opposed to doing their own part. I mean, I think, like you said earlier, I think there's good and bad. I think you can use medicine, but if you don't use behavior and you don't modify yourself, it's all for naught, and the outcomes have been horrible.
They're terrible. And we're paying a lot of money for those terrible outcomes. That's the worst thing. Just shoveling money down a terrible pit, and that needs to stop.
Yeah, absolutely. Where can people find you if we want to send them? Do you have a website or a practice? We can send them your way.
So you can go to my website, which is Dr. Brownstein, BROWNSTEIN.com, and I practice in West Bloomfield, Michigan. There's 7 of us practicing. My 2 girls are there. We're still seeing new patients, and we're having a fun time doing it. It's a really cool office, and if you would have showed me this office when I was in med school, when I was conventionally oriented to diagnosing pathology, prescribing the one drug to treat that pathology, I don't know what I would have done back then. Either my head would have popped off, or maybe I would have started a little earlier looking at this. But I don't think I could have processed that, back then. But medicine can be practiced the right way, and it can be done the right way. And I think that we're doing it the right way. We're having a good time doing it.
Well, I sure appreciate what you've done. I appreciate your books and your work and your passion, and certainly appreciate your time today coming on to talk with me.
Well, thank you for having me. Let's do it again.
Okay, we'll do it.